President-elect Joe Biden asked Dr. Fauci to serve as his chief medical advisor during this COVID crisis. Why are we talking about this? Well, because right here, Fauci says the U.S. is facing a very critical time. His exact quote is, "Nobody wants to modify, if not essentially shut down, their holiday season. But we live in a very critical time in this country. Yes, we do. Gotta shut it down just a little bit. Just a little shutdown. Just a little one." Of course they are. Of course this is assuming that Biden gets into office. And at this point, we've got to assume that at least through traditional means, this is what's going to happen. We're going to have a President Joe Biden. Okay. Might as well start prepping for that, and just accepting that, okay, well, if this is what's going to happen, what is that going to look like? It's going to look like more shutdowns. Why? Why are we bringing this up? Because we're going to talk a little bit today about how deadly the coronavirus actually is. It's terrible. It's going to wreak havoc. It's basically going to be the Mongol hordes invading China, but across the United States. It's colonization. It's systemic racism, all wrapped up into one disease. I apologize for that squeak in the background, boys and girls. My doggie has a new toy, and she really likes it. All jokes aside, here's the thing. Colorado is seeing health officials in a Colorado county believe they found a second case of a coronavirus variant from the UK, one that experts have said may be especially contagious. Man, she is just going to town on that thing. One that may be especially contagious. That news comes from a day after the first known case of the variant in the U.S. was announced in Colorado's Elbert County. Both confirmed cases in the suspected instance involving men who had been working at the Good Samaritan Society assisted living facility in Simla, about 45 miles northeast of Colorado Springs. Neither are residents, and they are isolating outside the county, Smith said. There's no indication at this point that this event has gone beyond the facility and into the larger community. Well, where there's smoke, there's fire. We know that these people, we know that there's asymptomatic spread, and these people have probably traveled around, visited with people. It's the holidays. It's enough time to spread it. Why in the world is this happening now? This sudden change. And if there is a mutant strain, this is a real important question I have. If there's a mutant strain of this virus, is it like the flu, where if you receive the vaccination against one strain, you have some level of protection against all strains for that season? Or is it just bad luck, chummo? You got the vaccine for the wrong strain. Sorry. Interesting questions, right? I know I've been rambling a lot. I just want to put this out there before I get really deep into this. Don't forget to like the video if you enjoy the content. Subscribe and share this out so people can see it. Now, we're dealing with, obviously, the deadliest virus in known history. For those of you who are just listening to this, that's sarcasm. Deadliest ever. And now we have a mutant strain. Makes it sound dramatically dangerous, right? A mutant strain that is especially contagious. Well, if it's especially contagious, how do you know that it hasn't spread into the larger community, number one. And number two, if we are dealing with such a deadly virus that we have to lock down everyone and everything, that we have to destroy our economy, that people around the world are not allowed to work, that we have to allow the largest transfer of wealth in modern history, perhaps in all of history, then obviously our healthcare staff is going to take this seriously. Around the world, this is clearly not something that you would want to come into contact with without some PPE, without some sort of protection for yourself, right? That's what everybody would think. It's what we would assume. That's what we're being told. Healthcare workers are heroes. Yeah. And when they're busy posting their dancing TikToks and they're running around like chickens with their heads cut off, trying to go from place to place in the hospital, ignoring other patients because they need a break from all this life-saving. Obviously, it's because we're dealing with the most deadly and dangerous virus known to man. Yeah? Or nurses are getting suspended for having sex with COVID-19 patients. Nurse suspended. Now, this is in Kemayoran, Jakarta. Nurse suspended after stripping off PPE to have sex with COVID-19 patient. A male nurse in Indonesia has been suspended after admitting that he stripped off his PPE to have sex in a toilet with a man infected with COVID-19. It's true that there's been a suspected incident. They point out that it's same-sex because I guess this is the statement from the Asep Ganawan, of the National Nurses Association in Indonesia. I don't think that matters. I don't care about that portion. There has been a suspected incident of a sexual relationship between a healthcare worker and a COVID-19 patient at the Wisma Atlet Emergency Hospital. He said the nurse must follow legal processing. The incident came to light when the patient boasted about the romp on his Twitter account Friday, according to the UK Suns. He uploaded a screenshot of WhatsApp messages between the horny couple, including details of lubricants and genital size. The patient also posted an image of the nurse's PPE laying on the floor as the pair got it on. You mean to tell me this nurse risked his life to bring one final fit of ecstasy to this dying COVID-19? Oh, you mean the COVID-19 patient lived, and the nurse tested negative later? The two were later administered COVID test. The patient was still found to be positive while the nurse tested negative? What? Well, that can't be. This is the deadliest, most contagious virus in history. There's no way. And our healthcare workers are just heroes. They wouldn't do, they're all people, and this virus isn't anywhere near as bad as what we're being told. I think you guys get the picture. Wrapping up here. We'll wrap up here with this. We're being told by the incoming administration, and to an extent the outgoing administration, that this virus requires so many sacrifices on the part of the American people. We're being told that 9 months of our lives are only worth $600 each. And we're being told that this transfer of wealth that's happening from the lower end private businesses, your mom and pop shops, to major corporations is for our own good. And I don't buy it, people, and neither should you. Now, that's not to say that we should not have consideration for the people around us. If you are close to or seeing at-risk persons, people who should be a bit fearful of even the seasonal flu, you should probably take precautions. It's a healthy thing to do. It's common courtesy, yes. Wear your mask if you are required to. If you feel like that will help keep people around you safe. But it's time we look at this in the light of reality. This is not the deadliest virus known to man. It's contagious. Can it kill people? Yes, it can. We shouldn't downplay it. We shouldn't. And healthcare workers, they do a great job. I'm sure they've been working overtime with all of this. But they're not superheroes. They're just people. Doing an important job, yes, but they're still just people. We have to stop deifying them and allowing them to deify themselves. And we have to stop vilifying this virus that is essentially just another flu. It's dangerous to a subsect of the population, yes. It's dangerous to certain peoples, of course. And you don't want it spreading through nursing homes. You don't want to give immunocompromised or at-risk persons this virus. You want to be courteous, of course. We all want to be nice to each other. We all want to be independent and left alone. And we all want to have our freedoms. Okay. But don't tell me that this virus is so deadly that nurses have to be in full gear all the time or else. That there's no way you can operate a business. That there's no way people can go to work. Don't tell me that. That's crap and we know it. That's all I got for today, everybody. I will catch you guys tomorrow, hopefully with a little less sass and a little more information. See y'all soon.